This is Healthcare's Missing Logic podcast, episode number 184. Today, our special guest is the American Organization of Nurse Leaders President, Dr. Robyn Begley. And we discuss the findings in AONL's latest longitudinal impact study on COVID and nurse leaders. Stay tuned for these important insights. Welcome back to Healthcare's Missing Logic podcast. This is the only podcast that shows you how to leverage polarity intelligence, an essential competency for healthcare leaders, and the missing logic in healthcare, so you can create healthy, healing organizations and become a thriving, resilient, and unstoppable healthcare leader.
We are your hosts, Tracy Christofferson and Michelle Trosett. We've been best friends and colleagues for over 30 years. And during that time, we coached healthcare leaders across North America around how to create healthy, healing organizations.
Today, we coach healthcare leaders and leadership teams to live thriving, resilient, and balanced lives, combat burnout, and create the best places to give and receive care.
This podcast is for the unsung hero of healthcare, the healthcare leader. We want you to know we see you and we'll be here for you each week. In this podcast, we're going to challenge healthcare's industry norms, flip limiting beliefs, and share proven strategies so you can be your best self at work and at home, live and lead intentionally, and experience well-being and joy.
We are glad you are here and look forward to sharing the journey with you. If you aren't totally convinced this podcast is for you, just listen to a few episodes and convince yourself.
Welcome, everybody, to Healthcare's Missing Logic podcast. This is your co-host, Tracy.
And Michelle, the dynamic duo.
Of course. Who else would it be? Who else would it be, right? Irreplaceable.
That's right.
Just another lovely day podcasting and talking to amazing people.
Yes.
Can't get any better than that, can it?
No, we are so blessed. We are so blessed. And today we are so blessed because we have a repeat guest, Dr. Robyn Begley, on our podcast. And she's just such a nice person, isn't she, Tracy?
Yeah. We attract people that are nice, I think. Yeah, she's really nice and she's very easy to talk with. It was just a great conversation, and I really enjoy just being with her and learning from her and the work that she's been doing. It's been really great. Yeah, she has been a wonderful leader for the American Organization for Nursing Leadership, AONL, and I've enjoyed just observing her leadership and her commitment to really reach out and collaborate with people like us and other people all over the world. And we're going to hear about some of her global activities in the podcast interview. But Tracy and I invited her because we have been watching and learning from the longitudinal studies that AONL has been doing in the COVID era, and they just put out another one recently, the fourth one. And so we're just thrilled to have Robyn on our show to tell our listeners a little bit about that. So it was a great conversation. And so let me introduce you to Robyn, and then we will get on with our interview. So Robyn Begley is the Chief Executive Officer of the American Organization for Nursing Leadership, AONL, and Senior Vice President, Chief Nursing Officer of the American Hospital Association, AHA. And in her role at AONL, she leads a membership organization of more than 11,000 nurse leaders whose strategic focus is excellence in nursing leadership. She oversees a number of key initiatives involving workforce quality and safety, and future care delivery models. In addition, she works collaboratively with the AHA to ensure the perspective and needs of nurse leaders are heard and addressed in public policy issues related to nursing and patient care, and leads the AHA Workforce Initiative. She serves on many boards, most recently as a member of the AONL Board of Directors, chair of AONL Foundation Board of Directors, and the Schwartz Center for Compassionate Healthcare Board of Directors. She earned her Doctor of Nursing Practice degree at the University of Medicine and Dentistry of New Jersey, now Rutgers. Oh, I didn't know that.
How interesting. And she earned her master's from Widener University in Chester, Pennsylvania, and her bachelor's degree from Georgetown University in Washington, D.C. She is board certified as an advanced nurse executive with the American Nurses Credentialing Center, and she was inducted as a fellow into the American Academy of Nursing in class of 2020. So we will now take you to our conversation with Robyn Begley.
We'll get back to the episode in just a minute. But if you're like many of the healthcare leaders we talk with, you continue to experience the fallout from the pandemic. Your worst fear is while you continue your search for the new normal, you're letting everyone down. If you're exhausted before you even get to work, or every time your professional life bleeds into your personal life, you feel angry, and you feel guilty if you take any time to care for yourself, we guarantee you're doing at least one of these things. You think you must choose between your professional and personal life, you sacrifice your personal needs, or you make yourself accessible 24/7. That's why we created the virtual Leadership Survival Bootcamp.
In the bootcamp, you'll learn the survival tactics to manage the tension between your professional life and your personal life, develop a survival strategy, and create your own unique early warning system so you can reclaim your life and have a positive impact on your team. Registration will be open soon, so go over to missinglogic.com/new-events and join the waitlist today for the February 2023 Leadership Survival Bootcamp. Well, welcome back to Healthcare's Missing Logic podcast, Robyn. We're so excited to have you back with us.
I'm really thrilled to be here. This will be fun.
Oh, yes.
Oh. Always fun.
Well, this isn't the first time you've been on our podcast. In fact, we were looking back, and the last time you were on was episode 95, which was back on May 5th, 2021. And now, all these months later, you're going to be episode 184. So we've had a few episodes in between. We were just talking about how now we have our podcasts on our YouTube channel. We're doing video now. So now people can not only hear you, they can see you. So again, we're really excited to have you back. So, Robyn, as you know, Tracy and I have been working with healthcare leaders to survive and thrive during these challenging times the last few years. And we've been offering a leadership survival boot camp several times a year. And then we have a thriving, resilient, unstoppable coaching program for healthcare leaders. And not surprising, many of those leaders are nurses. And we have been so appreciative of AONL doing the insight studies, the longitudinal insight studies of nurse leaders since COVID hit. We think it's really valuable data, and we know it's so important to keep our leaders strong during these times. So thank you for that. And if you could just start out by telling our listeners a little bit about the survey itself, like how you came up with the idea, how you plan it, what goes into it, the intention of it, and the items that you picked. Just a little background about the survey itself would be great.
Sure. Well, thank you. And first of all, I'd like to say thank you to you both, Tracy and Michelle, not only for inviting me here, it's great being back today, but really for what you've done for the field to support all healthcare leaders, but in particular our nursing leaders. And it has been such a challenging time, as I know you know, and we've talked about that. But thank you. Appreciate all the support for the field. A little bit about the survey. So initially, way back in summer of 2020, right after the beginning of the pandemic, we wanted to do a survey that, really looked at and investigated the basic issues. What were the pressing issues facing our nursing leaders? And initially, we received a gift from Joslin Insight, and they basically said, we want to help. We understand that, the nursing leaders are very challenged right now, and we want to help you do a very structured survey that would give us very credible information. And the first one that we did, as I mentioned, right after the beginning of the onset of the pandemic, we thought it would be a one and done. We really thought that, okay, we're going to survey our members, find the pressing issues, their challenges, and thinking way back to that, period of time, we thought it would be over then. Of course, we know that isn't what happened. So 6 months later, we wanted to repeat the study. That was early 2021. We found the need again to repeat it last summer in 2021. I believe it was August. Mm-hmm. And then thought this summer, we want to continue the longitudinal aspect of the survey because we were able to ask some of the questions are identical from the beginning through this fourth version, yet change the focus a little bit and look forward. So many of the questions remain the same, but also we've been able to modify the questions based on the environment and what was happening. And what we did in concert with our friends at Joslin, who continue to help us with this, basically, internally, we look at what potential questions we want to ask. We look at what are the issues in the field, and then using their methodology, they do some qualitative questioning of a pilot group before we do the larger survey. So it's been very effective. And, I know we're going to talk about the most recent study, but, it just adds value for us to have this information over time.
Yeah, totally agree. Definitely. So important. So kudos to you and Joslin.
Well, yeah, and it's not ending, right? Just keeps morphing and changing. And so I think it's really great to have your finger on the pulse of what is changing as we go forward. So this most recent study was titled Nurse Leaders' Top Challenges and Areas for Needed Support, Part 4. And that was published in October of 2022. So I think you mentioned the study was kind of done in the summer, and then the data was analyzed and the report. So you've mentioned it's kind of morphed. So what was the focus for this particular survey?
So, great question, Tracy. So, we wanted to, again, check the pulse of nurse leaders to see what areas have improved, what are some new challenges. And, as I mentioned previously, the survey focused on COVID-19. But as we are emerging from the pandemic, or I should say, learning to live with the after effects of the pandemic, we really wanted to, sort of switch the focus and make it future facing. We included new questions about workplace violence, as well as how nurse leaders spend their day and what functions that they do in their day that bring the most joy, and also what are those areas of frustration. So, and that was actually at the request of our president, Eric Martin, who said, that in his facility, he works in a children's hospital, that, he observed so many of his colleagues doing some things that were more administrative or, routine in nature that took them away from where they really wanted to be spending their time. That's with their teams, with their patients and families. And, it was just interesting conversation and dialogue we had prior to finalizing the questions. And so we added that, and we got some really great information.
Yeah, that's great. I love the way that you were very intentional of reaching out, hearing from people, coming back in, and then seeking overall input from everyone. That's really, really great. So I know one of the focus areas as well was asking, what are your top 3 challenges right now? So what came out on top for nurse leaders in this Insight survey?
Okay, so the top 3 challenges, and I don't think they're really surprising. The first one was emotional health and well-being of their staff. The second was, and these are all kind of related, I think. The second was staff retention. Additionally, some places did, in the very beginning, have furloughs and layoffs. And, it's been a little bit cyclical, but we wanted to keep the question the same. So the second top 3 of our top 3 is staff retention, furloughs, and layoffs. And the third, and this was a relatively new category added that rose to number 3, was travelers and the contingent workforce. So we know from everything we've been reading, everything we've been hearing, that, since our last survey, the number 3 survey to the number 4, and that was the duration of a year, the whole issue of travelers and contingency staffing really rose to the top. So, very telling that still is an issue, even though as we look across the country, we may see our hospitalizations of COVID patients going down, thank goodness, but the staffing challenges really still are quite acute. And, many reasons for this, but, the fact that many nurses took to contingency staffing and want to be traveler nurses, I don't think we're going to see a reduction in that anytime soon. Many hospitals and healthcare systems are still using quite a number of travelers.
Yeah, it really opened up the door for options for people to really take advantage of that for many different reasons, for their financial, family financial opportunities, and just to, I think, have a different experience during that time. And we actually did a podcast episode from someone from a staffing agency, and then brought the voice of those who are traveling and what it was like for them as well. And as Tracy and I work with healthcare leaders every week, you're exactly right, Robyn. Staffing continues to be one of their number one concerns that we hear about. So it's, and we've all been around long enough to know it's really always been a challenge, yes. But it kind of spikes and goes up and down, right? So, and we also noticed that their number one concern was the well-being, their emotional well-being of their staff, and that also goes along with what we hear and what we see about them caring for others and putting their teams first, and that's something they generally think about constantly.
Well, and that's a great point, Michelle. But I think, and what we've heard, from our nurse leaders. Again, this was a question that we wanted to ask consistently, but when we talk about the emotional health and well-being of the leader, that also is a major concern. And when for example, the chief nurses are worried and concerned about the emotional health of their directors and their managers. So, last week I was at an American Hospital Association board meeting, and the C-suite is worried about, their colleagues as well as, management at all different levels. So even though, I know that, obviously our frontline staff had the most contact and perhaps maybe the most trauma in dealing with, the challenges of COVID, it has been really quite a lesson to see that it's affected everyone, yes, and not just those in direct patient care. It is pervasive, I think, throughout healthcare right now.
I would agree.
Yeah, I would too.
It's
and everybody's tired. Sorry.
Yeah. And we knew that was, well, I'm just going to say, we kind of had a sense that was going to happen. That's why when COVID hit, we turned our attention to the leaders, because we kind of had that. We knew behind every clinician was a leader holding them up, right? It's not too long. If nobody's holding the leader up, right, the leader will fall. And so this is such important work that you're doing.
Well, thank you. Yes. We're trying to support our members and the leaders. Sure. And the one group that we're in particular focusing on from an AONL perspective, although they're all very important, is that frontline nurse manager.
Yes.
So that nurse manager, and that actually has been validated not only from the survey we're talking about today, but in other ways that we've reached out to through a crowdsourcing methodology, for example, and just actually in conversation with with our leaders and our members across the country. That nurse manager is really most vulnerable from a leadership perspective. And it's really not surprising when we look at it because, and again, I think some of us have had the opportunity to have many roles in nursing, and, and it's been a very long time, but when I was a frontline, nurse manager, it is just so all-consuming, the responsibility for staffing 24/7, and also, the patient outcomes. I mean, you're so close to the patients and, the patients' families, as well as your staff nurses. It's such a challenging job. And I think, in many organizations, they have a very broad span of control. Many people report into that, that frontline clinical manager, and just the burden that is pretty remarkable. So we have a number of initiatives to support our nurse managers.
Yeah, that's great. And we hear that too. And especially like the new emerging leaders, they're coming in at a time and being new leaders when things still, are far from stable and normal. So they need a lot of extra support. So I think it's great that you are supporting them as well. Very important, very important. We also noticed in this latest Insight survey that the financial resource availability, which you also have consistently asked, it jumped up to number 4 as the number 4 top challenge, just 1 point behind the third one. And again, financial challenges, some of the fallout of COVID, the travelers, and a lot of other things that have impacted hospitals and leaders. Tell our listeners a little bit about this result and other things that you're hearing from nurse leaders when it comes to financial resource availability.
Sure. So there's a number of things that are really, I think, impacting the financial resource availability. And if we read the newspapers too, we see that many hospitals and health systems, actually right now, for this year, we're in 2022, the projection is that 50% or greater of our hospitals and health systems will finish the year in the red. And, of course, there's always some systems and some hospitals that do extremely well and others that really struggle. I mean, that's been just the nature of healthcare. But to have that many that are worried about even breaking even is pretty remarkable. Yeah. Some of that is inflation and cost of supplies. So as we know, the cost of food, the cost of gas, I mean, that just the basic things that we struggle with on a daily basis in our personal lives are the same things, magnified for hospitals and health systems. So the inflation of goods, meds, supplies, food that we need to, feed our patients, et cetera, as that elevates, it erodes the budget. But also we have, not only the contingent labor, costs were we know in the beginning or as they were initially used, they were extremely high. Some of that has resolved. And I would say that on a whole that our travelers and our agency staff are not quite as highly reimbursed as they were, in the real thick of the pandemic. But we've also, and this is not necessarily a bad thing, we've been able to, or we've seen that we need to raise the salaries and raise the compensation for the rest of our workers as well. So, raises to keep up with cost of living are happening in hospitals and health systems. There is still an increased amount of travelers and contingent staff. So that is obviously more expensive than our regular staff. And just the combination of those combined have really led to a concern about being able to stay viable. And we've seen, that some organizations are cutting services. They're, in some cases closing beds. Some of that's financial, but other is because they don't have the staff to keep those, to keep those beds open. But then it's the vicious circle, because if you don't have patients, you're not, if you're looking at it from a financial perspective, you're not generating revenue. So, it's just one of those challenges. But, those are some of the things that we advocate for, quite frankly. AONL and HA, we feel the need to point that out to our legislators. We're very active in with our advocacy efforts at AONL to be able to speak with our federal legislators. And our goal is in every state to be able to have a relationship with our elected officials so they're aware of what's really happening in their home state regarding healthcare and nursing.
It's so important to keep everybody aware, right? Because change starts with awareness. Until we get that awareness, and it's difficult to get things to move forward in a way that would be helpful. And it's everybody's at risk. So while we're feeling the pain in healthcare and the leaders are feeling the pain, every community is at risk right now, right? And the healthcare industry is at risk. Everybody's at risk. Mm-hmm. And so I think it's just a critical moment in time for all of us. So thank you for your advocacy. Now, the other thing that's happening is we're hearing a lot too, and this was in your latest survey, was really around workplace violence and incivility. And tell our listeners a little bit about what stimulated adding that and just kind of some highlights of the results that you have found.
Sure, Tracy, happy to. And unfortunately, we know that workplace violence has been an issue facing healthcare workers, especially nurses and social workers, but really pretty much anybody that works in healthcare. This is not a new issue. I think in the past, first of all, as nurses, when we're dealing with people and with patients who lack capacity, we wouldn't necessarily consider it an incidence of violence if you were kicked or if you were hit. And, we'd say, oh, well, the patient didn't know what they were doing. And that could very well be true. But the fact is that it still could potentially result in an injury, that kind of thing. So, unfortunately, we saw that within the last couple of years during the pandemic, it's become even more of an issue. And some of it is verbal. So, whether it would be characterized as incivility, verbal abuse, in essence, this is probably, one side of the spectrum, but needs to be accounted for, needs to be addressed, mitigated before the fact would be the best. And we actually have, we developed guidelines for mitigation of violence along with the Emergency Nurses Association in 2016. But we felt the need this year to revisit and to really make sure that they were contemporary. So that work's been done along with the toolkit. And it's not just for nurses; it is really for all those in healthcare. Some of it may have come because of the I'm going to call it the politicization of the pandemic. And for a while there was a lot of incivility around. Do you have are you vaccinated? Are you not vaccinated? Why are you asking me that question? And just even the masking, et cetera. So I think tensions got really high during that time. Interestingly, I presented at the International Hospital Federation meeting a couple weeks. Actually, it was 2 weeks ago. And this is not a phenomenon that's only found in our country. And I was actually a little bit surprised about this, but I presented on workplace violence, and across the globe, this is reported as a big concern.
Wow.
So, it's one of those things that I'm sure sociologists and historians will be studying for literally probably decades. But maybe because of the pandemic throughout the world, this has become more and more of an issue. So we wanted to ask this question during the survey. And our last survey, we said, we asked nurse leaders, 72% of the people that we surveyed said that they witnessed bullying or incivility in the past year. So more of the verbal abuse. And pretty astoundingly, 53% witnessed incidents of physical violence in the last year, which is really disheartening. Mm-hmm. I think maybe the silver lining here is that it is being viewed as totally unacceptable. And, what are the strategies that we can employ to not even deal with the aftermath, but really to mitigate it, to prevent it from the beginning. Interestingly, too, the majority of bullying and incivility came from patients, families, and patients. So the patients, families, and the patients, followed by staff nurse and physicians. So that's staff against staff. But the first was definitely from the people that we're taking care of. And when looking at the physical acts of violence, patients and patients' families were found to be overwhelmingly the aggressors. And I don't think that's really surprising. That's, unfortunately what we expected to see. I think the numbers really shocked us, though.
Yeah. Yeah, they are high numbers. And I so appreciate you bringing that forward because, you hear about it, but I think, again, it raises the awareness. And what we've seen and what I think is so important is just that collective non-tolerance of it, so that you all can kind of stand together and dealing with it in the workplace. So, yeah.
Well, that's one thing. When it's patients and families, it's another when it's within your team, right?
Mm.
So it just adds to it, right? If you don't have the stability of that team and the healthy relationships with each other, it makes it harder to deal with the things that are coming at you from the external, from outside. So
Agreed.
one adds to the other. Yeah, certainly very concerning.
Yes. Well, now for some good news on this insight survey.
Yeah. Is there some good news?
Let's bring it on. And it goes back, Robyn, to something that you mentioned earlier, that you also are keeping your pulse on the leaders' emotional well-being. And we know that 2021 studies showed that there was an increase in nurse leaders not feeling emotionally well. But on this particular survey, it showed some improvement, and that a rise of those who consider themselves emotional healthy or very emotionally healthy was up by 16 percentage points. So we were very happy to see that. And we also appreciate that you are keeping your pulse on leaders that are leaving and those that are intending to leave. And the study showed 13% intend to leave and 25% are considering leaving. And what did the survey reveal regarding the reasons that nurse leaders intend to leave or are considering leaving? What are some of the rationale provided?
The top 3 reasons that nurse leaders gave to us was that, number one, well, I guess, the top 3, I think that's a better way to put it. They're looking for better work-life balance, for sure. Others said they felt burnt out and exhausted. And a third group just said they were looking for a new opportunity. And that's kind of, again, it can be viewed as a positive and as a negative because nurses and nurse leaders, they're in demand. So, healthcare is one sector that is very broad and becoming, more than just about healthcare delivery. So there's lots of industry. I mean, I opened my email this morning and, big companies like Walmart and CVS and are not just looking for people to deliver care, but they're also now including them in the strategy and in the leadership of those companies. So the thought leadership that nurse leaders can share, I think, is really is beginning to be seen as really valuable, which is a great thing. But of course, we worry about people leaving our health systems and our hospitals. So we have to factor that in. Mm-hmm. I know we're all working on better work-life balance, and that is really a priority for all of us. I participated on the National Academy of Medicine, steering committee on health worker well-being. The big report came out October 3rd. Now the steering committee is in the process, and the report's great. You can go online, you can access it, but it's not just a plan to sit, on the shelf or to be a document in your computer. The challenge now is really to be able to take the recommendations and the actions and make them real. And it's not just about health systems and hospitals. It's about universities. It's about, it's about our business community. It's about our insurers. You name it. It's pretty comprehensive. It is about our legislators. We need some policy to help support this. And so it's a very large issue, as we all know, and we need to be focused on it, which I believe we are all realizing. Burnout and exhaustion is something that I know, you both work very much in that space with our nurse leaders. And, I do have to say many of our nurse leaders, when we look at the demographics, I mean, they are in some, we have a large percentage in the baby boomer population.
Yeah.
So they're looking to maybe either kick back a little bit, in some cases retire altogether. And, I think it's been a time of examination of, okay, what's important to me and what am I going to do with, the rest of my either career time or my, and is it time to just say, I think I've done enough for my career, and I'm going to sit back and maybe do some family related or some other personally related things.
Yeah. Yeah.
Well, and I think COVID also, right, had people reevaluating what really matters most in my life and what's my next step and how do I want to contribute towards the end of my career, those types of things.
Yeah. And I think
end of the career and really all through all phases, I think that's what COVID has really had people reexamine, the purpose of their life, the purpose of work for them, and, how they want to spend their time. And that's not necessarily a bad thing either.
No, it's not. It's not bad at all. And I think in the work we've been doing, what has really emerged is they never really had a strategy to find balance in their life. I think nurse leaders are so committed, right? And they care about their team and they always show up. And so I think many of them have paused and have said, hey, there's got to be a better way. They still love what they do. They believe in the work and the profession. It's just finding some strategy so they can really have more work-life balance, which is really important. Yeah.
Joy in the purpose of work, for sure.
Yes.
So I have a couple more things if you want me to review that I think would be interesting to the audience along this line. We did ask if our members plan to leave nursing altogether. 64% said no, 8% said yes. So although 64% is a really good number, 8% thinking they're going to leave is concerning. We asked about what solutions your organization can do to improve your work satisfaction. And the number one response by far was to improve staffing shortages and workforce challenges. Number two was increasing salary and compensation. So two things that we weren't really surprised at seeing. And the survey also showed that the vast majority of organizations have responded to the staffing shortage by increasing wages, bonuses, or other compensation. So, we talked about that a little bit related to the financial status, but I believe that, healthcare organizations just understood that they needed to keep pace and needed to increase wages. And that's for nursing, but for all, healthcare workers in general. And they're also listening and responding to the voice of their staff nursing. That was the perception of our nurse leaders in the study, that their administration and their organizations were listening. So that was great to see. So, so we have a lot of work in front of us, but, again, when I meet with nurse leaders and have the opportunity to travel, and travel is picking up again. So, I've been really fortunate this fall to go to a few places where I was able to interact with a lot of people. And, they're tired, but they're positive. As you said earlier, nurses are really special and they love what they do for the most part. Don't always like everything that's involved with with completing their job on a daily basis, but they love their mission in life and taking care and providing optimization of their patients' health and connecting with their families is so important. And from a nurse leader's perspective, supporting all that still brings a lot of joy and meaning to our members. And so it just reinvigorates me to talk to people. Sometimes it makes me sad to hear what they're experiencing, but really focuses me on how AONL can really help support them.
Yeah, that's great. Yeah, Tracy and we also had the privilege to be out again this fall, and we were able to, we were keynote speakers at both the Minnesota Organization of Leaders for Nursing and the Ohio organization. Mm-hmm. And it was just palpable how much joy people had just being in the same room again after like 2 years of a hiatus, not being able to have their conferences, and a real energy to just move forward right now. So, and I know it filled our cups too, just being with people again.
Yeah.
That was great. And they're a resilient group, right? And I think, it's also, while there's lots of challenges and, lots to do, there's so much opportunity at the same time, right? And so much opportunity to think out of the box, to do things differently, to transform how we're delivering care and the experiences that our clinicians are having. So, yeah, it seems like, we're kind of at the bottom working our way up, but we'll get there, right? We'll get there and we'll bust through that. I have no doubt about that. So this is really great information to guide those changes that do need to happen. So we look forward to the next report.
Us too. And I don't think anybody finds that they want to return to the way things were.
Right.
I think throughout healthcare, we know there were changes that needed to be made and, transformations that needed to be, completed even before the pandemic. It really pushed us to see the challenges that we had, and it really exposed them, I think. But no one wants to return to the way things were. People are looking forward to the future, which I think is very positive. It's going to take a lot of work, and for us to really be thinking in new and different ways. But, that's sort of energizing. And I think the challenge is just having the time to do it while, the train's still got to run. So we have lots of patients this winter. We know RSV is really placing a challenge on many hospitals right now, particularly with the kids. Flu season is projected to be really, really difficult. Those things are things that we deal with anyway. So having the protected time to be able to really think for the future, I think is a challenge. But we have to do this. We'll figure it out.
Yeah. Well, you just have to make those choices, right? And make a little bit of time here and there to kind of sit with what needs to happen and do that designing kind of work, right, that the leaders need to do. So, well, thanks so much. And, now we're on to the missing questions, Robyn.
Uh-oh.
This is the most important part of the whole interview.
Oh, boy. You told me not to worry about this.
Nothing to worry about. Well, you've brought such rich information to our listeners, and it's all kind of, we've been focused on, the profession of nursing and the challenges and the opportunities. But we want our listeners to get to know you a little bit too. So these are more personal questions, and not too personal though. Personal enough that we get to know you a little better. So just relax. So the first one is, where is your favorite place to vacation and why?
Oh, okay. Well, I have the very amazing good fortune of having a very tiny second home in the Florida Keys. And when I go there, there has never been one time that I haven't, wanted to stay upon leaving. So even though I don't know that I would consider that a vacation necessarily or a destination, that is my happy place, I must say. And, my husband and I really enjoy visiting. Our kids love it. And that would be my answer. Lock it in.
Yeah.
Lock it in.
Lock it in.
You didn't have to phone a friend. Good deal. Oh, I love that. Hey, if it's your happy place, that's the best place to be.
Vacation.
Right? You're trying to take a break, right? All right, here's the next one. What is your favorite book right now that's on your nightstand?
Well, I just got, I don't know that I would consider my favorite book ever, but I can't wait to dive into it. It just arrived yesterday. Jerusalem, the Biography.
Ooh.
And it is a very thick book, which has me a little intimidated, but I mentioned I was traveling for the International Hospital Federation and was able to have a 1-day total immersion in Jerusalem on the way back. And it was just last week, as a matter of fact, that I got back. And the richness of the history, the religious aspects, the archaeology. It was just almost overwhelming, and I wish I had more time. So I asked our guide, if he would recommend a book, and he said Jerusalem, the Biography by Simon Montefiore. And it just arrived yesterday, and I usually read on Kindle, but I know that this was a book that had lots of pictures and that my husband and I would share. So that is sitting on my nightstand. Actually, it just got here. I thought that would be a treat to start during the Thanksgiving long weekend. So haven't opened it yet, but looks great.
Oh, that's wonderful. And having been there will be a whole different experience in reading the book, right?
Yeah, absolutely.
Oh, that's great.
Okay, well, that's exciting. All right, so here's the wrap-up question, Robyn. So, we teach healthcare leaders about polarity intelligence and to have more of a both-and mindset when it comes to many of the challenges that we deal with on a daily basis. And polarities are just interdependent pairs of values or issues that seem to be contradictory, but they actually need each other for a greater purpose. And we all have preference poles. So even though they're both equally important because of our human nature, we may tend to prefer one pole over the other. So I'm going to share a polarity with you. And without overthinking it, just let our listeners know what your preference pole is. Okay?
Okay.
All right. Planning and executing.
Without a doubt, executing.
Okay. Go, Robyn.
That's good to know. Yeah.
Plan, do, act, check. It's act, plan, do. I spent my career really in operations. So, and a lot of that included planning and, strategic planning, operational planning. But when the rubber meets the road, sometimes you just have to act. And that was sort of, and do the debrief after. And best laid plans do not always, commence in that fashion. So I would say I'm an implementer for sure.
That's so great to know too, to know that about yourself and for your team to know as well. So that's awesome. Well, is there any closing remarks you want to make before we wrap it up, Robyn?
The only thing I would add is that I want to thank both of you again for supporting our field, but also to our listeners who I would imagine are mostly healthcare leaders. And, it's been quite a few couple years, and I'm just still amazed and humbled when I'm able to visit and, see that patients are still really the center of all the activity. And, I had a family member who was recently hospitalized pretty seriously a couple months ago. And to see the care he received in the hospital, it was just incredible to see how everyone rallied and supported not only him, but, the entire family. And so, great things happen every day, and I'm so grateful.
Thank you. Thank you. And we're so grateful to have you on our podcast and really grateful to have your leadership at the helm of AONL. And I think you just have been an advocate for the leaders out there and certainly have been very collaborative with many others. So thank you, Robyn. And for our listeners, this wraps up another episode of Healthcare's Missing Logic podcast, and we will see you on the next episode. Have a great day. Stay safe and healthy. We hope you enjoyed this episode of Healthcare's Missing Logic podcast, now a top-rated podcast for healthcare leaders. Please share this podcast with other healthcare leaders and anyone else you think would benefit. We are certain that if you found value in it, they will too. If you haven't already done so, please hit that subscribe button so you don't miss any episodes. And also, it would mean the world to us if you took a quick moment to leave a rating and review on Apple Podcasts, Stitcher, or your favorite podcast player. It helps to get the word out about our podcast and incredible guests. Be sure to subscribe to our YouTube channel if you want to watch our podcasts. You can also follow us on our Missing Logic social media channels, LinkedIn, Instagram, Facebook, and Twitter. Until next time.